Okay, Erica Filipovitz and Lindsay Moss are with the NAPA Center of Chicago. And this is the intensive therapy that we were talking about. And I look forward to hearing your presentation. So I'm going to step away and let you all speak. And we know we, of course, welcome our kiddos, but if they get really rambunctious and they need a minute or two, remember, you will be able to watch the presentation from another room. So that I just want to let everybody know, because we want everyone to see, but we also want everyone to hear. All righty, here you go. A big warm welcome for them. Thank you. Awesome. Thank you.
Thank you for having us here today. I'm Lindsay Moss. I'm the clinical director at NAPA Center in our Chicago location.
I'm Erica Filipovitz. I'm a speech therapist and our speech therapy manager in our NAPA Chicago location.
Is that better? Okay. I'll try to speak a little louder. Is it good? Okay. So first, it sounds like maybe our name has been brought up already, but has anyone done any intensive therapies either at NAPA or at any other location? Or like any other facilities? Okay. All right, so some people are familiar. So today we're going to talk a little bit about our intensive model and our approach at NAPA Center and how we take an interdisciplinary approach within our team. So what we're hoping to get through our presentation is to discuss what therapies we offer at NAPA as part of our interdisciplinary approach, how NAPA approach differs from other models of treatment, and how all of our disciplines work together to maximize the benefits of our intensive program. So kind of going through basically with our intensive program, our kids will come for 3 weeks at a time. They're seen Monday through Friday, every single day. And depending on what their needs are, a combination of OT, PT, or speech might come into play. So this is just a very general example of maybe some different patients and what we would recommend for them. So patient 1 might come in and do 2 hours of neurosuit, then have an hour of speech, and then an hour of PT. So this little girl underneath is wearing our neurosuit. Patient 2 may be doing our spider cage, which is featured in the picture, feeding session, and then 2 hours of neurosuit. And then patient 3 could be having an fine motor OT session or a sensory OT session, a speech communication session, including AAC, UGL, which stands for our Universal Exercise Unit, which is used with like weights and pulleys, and then DMI therapy, which is featured in the picture below. Not every child will receive 4 hours. Not every child will receive 4 hours of therapy. Usually about 3 to 4 is our recommendation, but we always take into consideration what children are able to tolerate and what's going to best meet their needs. So when we're designing an intensive program, we look not just at the child's diagnosis, not at what we've seen before, but as each individual child as a whole. So looking into their medical history, where each individual child is as far as their level of function, and then what the goals are for therapy. So what you as the parents, other providers are looking for functional gains. Our program, as it's stated, it's an intense program. So we make recommendations within our disciplines to maximize the child's therapeutic outcome. We want to make sure that they're safe and effective at the same time. And we are mindful of fatigue levels for sure. Certain level of fatigue is expected, but therapy does not, more therapy does not always equal more. So we always take that into consideration as to how they're going to best tolerate the therapies that we do. And then, so again, these kind of go through all the things that we sort of look at. Just briefly touching on funding sources. We do accept some insurances within our program. Some sessions do, depending on how many you do and what your insurance covers, there is some out-of-pocket expense for the families. So we do consider financial commitment as well when we're making recommendations for number of hours of therapy. A lot of families will seek funding through different grants or do fundraising as well to kind of help with the financial costs. So going into a little depth of our treatment techniques and what they are. So our neurosuit is considered to be a dynamic movement orthosis. And the principles behind it is to load, align, and compress the body. So the little girl in the picture on the top right, she's wearing our neurosuit. It's always worn for 2 hours at 2 hours a day, and it's with a PT and or an OT. And during that time, they're performing functional tasks repeated throughout the intensive program. And then there might be modifications as needed. But basically, you'll kind of see what you might see in a traditional OT or PT session. The suit is just kind of an extra tool that we use to help give more input through the body to maximize what we're doing. Dynamic movement intervention. Is anyone familiar? Have heard of it before? Okay, a few. So this is a treatment approach that's starting to get a little bit more popular, but we've been doing it at NAPA for quite some time now. Essentially, it provokes automatic postural responses in the brain. And what we do is we put the child in new novel positions or put them through different exercises that they may not have experienced before, so that they don't have a chance to kind of learn a pattern that they are used to doing. They sort of have to have a quicker response. So what we're looking for is to tap into that neuroplasticity within the brain. So the little girl over on the left-hand side, she's being suspended in the air and working on keeping her head and trunk vertical up in midline. Spider cage is another therapy that we offer. So that's the girl in the bottom right. She's wearing a belt, and then the bungees are attached to our cage system. So this helps to unweight the body, again, just to give more feeling of being upright without taking the full weight of the body weight. So this allows children to be in different positions that they might not be able to do independently without support. So it gives them the feeling of being upright without having physical support from a person, which a lot of them might be used to doing. Google, it's the acronym for it is actually in a different language, but we will call it the Universal Exercise Unit. It's done within the same cage structure, but without the bungees. And this is a pulley system with weights. So a lot of exercises or machines you might see in the gym, we can kind of set up with the equipment we have for kids that need to be working more on like functional strength with weight resistance. And then we also offer traditional functional OT and PT sessions as well. So those are sessions if there's any of these that we don't feel like is appropriate for the child based on the information and medical history that we have. We also offer that traditional PT or OT session.
In addition to what Lindsay said, so our kids do motor hours, but they also do feeding and speech hours. So in our treatment and feeding, we use a relationship-based approach. So we really think about the sensory portion of feeding, the nutrition portion of feeding. Both our OTs and speech therapists do kind of take a comprehensive approach, also working on oral motor skills and the social experience overall associated with eating. We target pleasure taste, we target G-tube feeds, we target anything kind of to advance your oral motor skills as well. In addition, in speech therapy, we do a lot of AAC, so trialing and integrating a lot of AAC access methods from switch to eye gaze to touch. All of our therapists have a really comprehensive knowledge of access points as well as language, so how we can integrate AAC systems into your daily life and really kind of transfer that knowledge back home. The other therapeutic tools we offer, here's a big list of them, and I'll kind of go over them just briefly, not in too much detail, but we have a whole body vibration. And what that does, it provides input to the body to manage muscle tightness, tone, and spasticity, all while improving posture and balance. Theratogs, which is up at that top left photo, she's wearing Theratogs, and that's a type of DMO that provides compression and supports alignment. So all of these treatment techniques are in addition to the therapy that we use. E-stim, which is that little boy, he has it on his arm in that bottom photo, and that's going to stimulate muscle contraction at a therapeutic level to provide both sensory and motor input during functional tasks. We use the listening program, which is just used to strengthen the neural pathways for better learning and processing info, and we do that again along in our OT or speech or PT sessions. K-tape, little guy in the bottom left has that on, and what that's going to do is provide biofeedback to inhibit or elicit muscle activation. And then we also use prompt in speech therapy, which is just a tactile feedback. So you're aware of where your articulators are. And again, in congruence with speech therapy. And finally, we use vital stim, which is it stimulates muscle contraction of oral musculature in congruence with eating and swallowing. So we do that in feeding therapy as well.
So as part of an interdisciplinary team, our biggest thing that we want to make sure we're doing is that we're making the child's treatment most successful for them. So these are some of the ways that we ensure that success for our patients. The biggest one is team communication. We do that through weekly meetings. We have times where we meet to discuss all of our patients and review anything that the team feels like they want to discuss as a whole. There's ongoing communication kind of before and after sessions, checking in with each discipline to see how the child's participating that day, if there's anything that's been working well or things that we feel like we need to adapt and change. We also share our individual areas of expertise. Our therapists come from kind of all different walks of life and all different backgrounds. So we are very big on sharing our education and what we have taken with us from previous places. We're always learning about kind of the latest treatment modalities. That's kind of how we developed that really big list that Erica talked about before, and making sure that we're staying up to date with kind of what research is showing that's going to make the most improvement in our population. We use multiple frames of reference within our treatment. The biggest thing is we look at the child as a whole. We don't consider just their diagnosis. We look at everything about them and how we can really maximize the therapy for that individual child. We also within our own clinics, we do comprehensive training on complex conditions. So every therapist who comes to NAPA that is onboarded, we have a 12-week training program that they all go through. And we go through our intensive model and the populations that we serve to make sure all the therapists have that same level of knowledge. We also foster a global developmental perspective from all disciplines. We really hone in on prioritizing which impairments we want to address and which interventions that we're going to provide are going to give the most bang for their buck when the child is here for our intensive program. So we have a video. Okay. So the families gave us permission to speak a little bit about our kids. So this is Luke. He just turned 3, but this was his first time doing an intensive. He's trying to stand up from the floor. So you can see the therapist is giving him quite a bit of support. He's not a super happy camper about it, but he's working really hard. We definitely work through tears, but it is really, we do see the benefits. So here's him after he's been working really hard coming up. So you can see he needs a lot less help. Still not pleased, but we're all very happy and cheering him in the background. Here's an OT session. He's working on picking up and putting a toy into a container. And then after his intensive, he's working really hard getting those blocks into that container. And then I think we have one more. Oh yeah, and stacking blocks was a goal for the families that they wanted to work on. Okay, and then this is his first intensive going through walking in a gait trainer. So he's the therapist is kind of helping him to advance and take steps. Kind of having a hard time putting weight through his legs. But then in the next one, so this is a few months later, so it's actually a second intensive at the end. You can see he's initiating his steps a little bit more. He's actually in a different gait trainer that's giving him some different support. This is an example of an activity in DMI where we do some suspension in the air. So not all activities will look like this, but by being upright against gravity with less support, we're working on that postural control. And he's getting happier as we're going through. And then here's him in the spider cage, getting some activation, getting on his feet, with a little bit of less support from the therapist, so she can really get a little bit lower to work on that leg strength. And then he's standing up. So that was Luke. And then our next video is actually a little chicken. Okay, a little chickadee. She actually has Casey and Q3. So her name is Olivia. So this is a DMI session. So working on coming up into standing. So, and then with DMI, you'll notice our handling tends to be a little bit lower away from the trunk. So really having the child work on more of that postural control, kind of from the pelvis up. A lot of times the therapies that you might see, the therapists tend to hold more onto their trunk a little bit higher. So while we do take into consideration, posture and alignment within DMI, we also look on getting like more we call it distal, or more further away from the core, so that's really going to be an increase in demand of the child. So. Oh, that's some notes here.
All right. So as Lindsay kind of touched on, I think a really big part of NAPA's success is the interdisciplinary intensive success. So developmental progress does not happen in isolation. So a lot of times, even if we don't even incorporate speech into our sessions and we just do some motor hours, parents are often reporting language birth and gains in cognitive skills following an intensive. The other thing kind of about being interdisciplinary is fine motor skills are going to be built upon gross motor skills. And then overall, all developmental skills are going to be built on an organized sensory system. So as we kind of work together and share our knowledge, we just build on these skills for our kiddos. Overall, we're going to take a big developmental perspective. So we view our children in light of the learning pyramid, which gives us a greater understanding of the primary impairments that we are going to address. And then we're going to scaffold that learning and the level of the pyramid, but also utilizing the strategies to maximize the foundation of progress. And last, teamwork is essential. We're always working together, OT, PT, and speech. We find that maximizes the child's greatest potential as we're chatting and sharing and making sure that we're getting the most out of the intensive process.
So we do have a registration process for our intensive program. Our registration for 2024, so for next year, is October 5th through the 8th. In order to sign up, you have to fill out an intake form, which is available on our website. Intakes for our registration were due on September 5th, so the date is passed. However, you can still submit an intake form and be added to our wait list. I will say our wait list is ever changing. So don't feel like if you sign up and get on a wait list that means you're not going to get into our program. Things happen and change all the time. And we always try to get as many families in as possible. So please sign up if you're interested in our program, and get yourselves on the wait list. There'll be more details about registration on the website as well. And then we also have locations across the country as well as the world. So we have, we're in LA, Boston, Austin, Denver, Chicago here. And then we have 3 locations in Australia. We have Sydney, Melbourne, and Brisbane. And then we're opening up the UK this November in London. So if you guys want to be world travelers, you can check out those places as well. But yeah, that's all of our locations. And then these are just some a couple local foundations as far as funding. There's so many if you kind of do a search on funding sources. So a lot of them can be specific as far as like if they're like for particular diagnoses, or some are specific to therapies for children. So definitely worth checking out if you're looking for additional funding sources to help with the cost of the intensive program. So, and time for questions. Yeah. Yeah. Yeah.
In terms of evaluating, so my daughter,
Mhm.
so a lot of this stuff.
Sure, absolutely. So the first question was about our interaction communication with the therapists in school systems. So as far as we do cater to local families, and we have a traditional kind of weekly sessions as well. So as the families want us to be involved within the school, we will definitely foster that communication. We're always open to the home therapy team, whether that's in schools or outpatient, to connect with them. Part of our intensive program in the last week is that we do put together a home exercise program that includes activities for families to continue doing at home, but also to share with their providers. So we're definitely open to communication in that way. Because we are an outpatient like medical clinic, we can't really speak to like IEPs, but we can definitely talk with the therapists for sure as far as like what we've been working on, so that they can kind of take that on more within the school model. And then your second question was about older kids and how we cater to them. So our program goes from birth all the way up to we had a woman who was 33 with a neurological diagnosis that came to us for an intensive. So we definitely see a wide range. I feel like our bigger population, as far as the age range that we see, is usually between 2 to like 8 or 9, but we definitely have teenagers for sure that come in. We have evaluation tests that we can do for assessments, but we always will kind of cater to what their needs are. Good question. CME. So we no longer do CME. We transitioned through DMI. So DMI and CME are have some similarities as far as the treatment and like what the principles are behind it. DMI we transitioned into so that there's just more availability as far as continuing education and learning within that treatment. So that was where we're going from there. So we don't do CME anymore. Yep. For sure. Yeah, that's a great question. So the question was, if a child comes for the intensive program and then they leave and go home, do we see a regression? We tend to find after a few weeks after the intensive, we usually get reports from families that they see an increase in the skills that they were building upon within our intensive model. Typically we hear that usually about 6 months out is when they start to see not necessarily a regression, but more of like the gain isn't as rapid as it was. So a lot of families who do intensive programs, they might do 1 to 2 intensives a year. As far as regression, I think the only time that we might hear about that is if the carryover for their weekly therapies or home exercise programs are not being implemented as regularly. So kind of speaking to you at the gym, like, yes, if they stop cold turkey and we're not doing any therapies out after the intensive, that we probably would see some regression. But if they're kind of doing their normal routine after the fact of their weekly therapies, whether that's school or outpatient or a combination, we tend to see continued progression with that. Yeah. So we do. So again, we have those typically 3 to 4 hours of therapy during the intensive. So each hour will provide usually anywhere from like 2 to 4 exercises per hour to take home. We do instructional videos with the families We try to have the families be hands-on in the sessions to kind of teach and train and support so that they feel comfortable and confident going home and sharing that. You're welcome. Yeah. Yeah. Yes, yeah. So all of our therapies do outpatient kind of weekly traditional therapies in conjunction with intensives. And then if a child who comes to us weekly is enrolled in an intensive session, they will stop their weekly sessions for those 3 weeks to do their intensive and then jump back to their weeklies. Yeah. Yeah. Is the Trexel still in my life? Yeah.
We don't have a partnership.
Yeah, yes,
moment.
yeah, we don't have one at the moment. I know LA at one point had one. I'm not, to be honest, I'm not really sure if they still in it, that ended. So yeah, we've been working on a partnership with them. It's just been a little tricky, but we do have contacts as far as giving families resources to get a demo. Oh yeah, sure. So the Trexo, it's Rifton who makes the pacer and other equipment. It's basically like a robotic gait trainer. So it has components that you will put the child in that allows the machine to move the child in a walking pattern. And they can modify or adapt it based on like how much support the child participates in and how much the machine is doing, and you can change that over time. So yeah. The Trexo. Yeah. Yeah. Mhm. Mhm. Yeah. Mhm. Yeah. Mhm. Yeah. Mhm. Mhm. Sure. Yeah. It's kind of so definitely when you sign up for an intensive session, there is a deposit that you put down, and that money kind of depending on if you are unable to commit to it, we try to, you know, if you can do a different date, we try to kind of push it to a different time. I'm not super specific because I'm not the money person. I am the therapy person. But essentially like there is a deadline of like how much notice in advance kind of pre-intensive before that deposit is not refundable. And then yes, if once the insurance they go through your benefits and what your insurance is going to cover, they do ask for the money up front for any sessions that are not going to get covered. If it turns out that your insurance will cover them, we will reimburse you that cost. As far as refunding back for sessions, a lot of it is a case by case basis. So it's really hard to answer that. There's a lot of factors that go into play as far as if we're able to refund. Definitely if there's like a serious illness or injury that happens during the intensive, like a hospitalization or something, that money would be refunded. But again, it's a little hard to give that like a specific answer to yes or no. Yeah. So we don't do any like physical exam prior to an intensive, but from with the intake form that the families fill out prior, we do get a lot of information, from you guys as far as like what the child, does is able to tolerate. We do offer, in person or over the phone screenings with the parent to kind of get more information if you have questions or concerns specifically. Like I said earlier, we do take fatigue into consideration, kind of get a history of like what types of therapies the child's currently doing, how they tolerate those sessions, how long those sessions are. Do they do OTPT speech back to back? Do they need a break in between? So we kind of will have a conversation ahead of time. And we always, depending on the age, that will also take into account as well. Yeah. I'm sorry. Say it again. Well, that's a good question. I feel like we definitely, there's a lot of data that kind of goes up to the higher ups, but they look at a lot of data points as far as families that are coming to us currently, and if we're noticing a cluster from different areas, they'll kind of just take that into consideration. So we are doing two, we call them pop-up sessions. So one is in Charlotte. And the other one is in Tampa. That's going to be happening in 2024. Those are going to be along with our registration as well. So that's just a one-time 3-week intensive in those two locations. So that sometimes the pop-ups too will kind of give us sort of like not specifically those places, but just kind of the area to see like where there's interest as well. So a lot of it is like data specifically, yeah, planned. Yeah. Are the pop-ups the same? Yeah, sometimes they're a little different, but I think this year they're going to be at the same time. Yeah. Yeah, no, it's okay. Go ahead. That's a really great question. I feel like I think we're known pretty well through our, like the pediatric world. So the therapists that are really interested in the world of pediatrics, I feel like a lot of our newer therapists have commented, like just kind of following us on social media, and that's how they've seen, what we do and are really interested in that. We do, in all of our clinics, take on clinical students, OTPT and speech from all the colleges all over. So sometimes we'll pull them in as well if we feel like that they're a good fit within our program. But we always manage to make it work. I don't know if any other comments.
Yeah, I think the training program also allows us to kind of shape our therapists to continue to move forward. So I think I can speak from personal experience. I found NAPA through social media. I wanted to work in the pediatric neuro rehab world, and the training process kind of brought me more success as a therapist.
Yeah, I think that kind of sets us apart too. A lot of people are very interested in the fact that we have an extensive training program, because many places don't offer the amount and level of training that we expect for our therapists. Yeah. I mean, we're pretty great. Um, there's a few, so not as far as like our program, like kind of what we offer. I think that's like sort of what sets us apart, is like our program is unique. We do, like, we're definitely very supportive of other intensive therapies that are offered, because we know that there is such a need all over for so many families. So there are some therapists in New York that do DMI intensives in Long Island. He is Jake Zazali. He's actually the founder of DMI. He's in Long Island, and his Get Your Baby Moving is the name of his clinic. So, yep. You're welcome. You're welcome. You're welcome. Yeah.
Yeah, I can speak on that. Yeah, so our Mastering Mealtimes program does kind of take the framework of all of our feeding therapy. So you would do an intake with the speech therapist or the OT of that clinic, and then we set up a program for you just similar to kind of the regular NAPA intensive model. But yeah, we'll work closely with you to kind of figure out, we're not like, oh, we're gonna get you G2 weaned, but we definitely kind of set up a program in which you are able to work towards that with your doctor, with your dietitian, and then with us as well, and kind of giving you a holistic approach of feeding therapy with that. Yeah. Yep. And then we'll take a look at your intake, and we really work well together about just figuring out, is it going to be the Mastering Mealtimes route? Do you have other OT and PT needs as well? And it's based on your goals, but also our recommendations.
That's a great question. Yeah. So as far as housing, when you're in an intensive, so in Chicago, we do have a partnership with Ronald McDonald. And then we have some hotels in the area. So we're located in Niles. And they will give some discounts to the families specifically. It's definitely clinic specific. It's not every place has that has the Ronald McDonald available, but we do on our website for each location have resources for families as far as housing. I know a lot of families do like to do the Airbnb route just because 3 weeks is a long time to be away from home. So it's nice to kind of have your own space, but we do offer that for families for sure. Yeah.
All right. Well,